Here are 3 USMLE-style questions focused on the topics of RNA processing, polyadenylation, Kozak sequence, RNA polymerase functions, and the effects of inhibitors. Question 1. A 25-year-old woman is diagnosed with a genetic mutation in the polyadenylation signal of a gene. This mutation is located just before the 3' end of the gene. Which of the following is the most likely consequence of this mutation on the pre-mRNA? A. Decreased efficiency of mRNA splicing. B. Inability to add a 7-methylguanosine cap to the 5' end. C. Lack of the poly A tail at the 3' end of the mRNA. D. Failure of ribosomal subunit binding at the Kozak sequence. E. Increased degradation of mRNA at cytoplasmic processing bodies, P-bodies. Answer. C. Lack of the poly A tail at the 3' end of the mRNA. Explanation. The polyadenylation signal, AAUA, directs the addition of a poly A tail to the 3' end of the mRNA during transcriptional processing. A mutation in this signal would impair the addition of the poly A tail, affecting the stability, transport, and translation of the mRNA. The 7-methylguanosine cap B and splicing A occur earlier in processing, and the Kozak sequence D affects translation initiation, not polyadenylation. Question 2. A patient consumes Amanita phalloides death cap mushrooms and later develops severe hepatotoxicity and dysentery. Which of the following is most likely to be the cause of her symptoms at the molecular level? A. Inhibition of RNA polymerase I, preventing RNA synthesis. B. Inhibition of RNA polymerase II, preventing mRNA synthesis. C. Inhibition of RNA polymerase III, preventing tRNA synthesis. D. Inhibition of DNA polymerase, preventing DNA replication. E. Inhibition of ribosomal protein synthesis. B. Inhibition of RNA polymerase II, preventing mRNA synthesis. Explanation. Amanitin, found in Amanita phalloides, inhibits RNA polymerase II, which is responsible for synthesizing mRNA. This disruption leads to the inhibition of gene expression and can cause severe hepatotoxicity, as mRNA production is necessary for the synthesis of critical proteins. This results in cell death and organ failure, particularly in the liver. Question 3. A genetic mutation in the Kozak sequence of a eukaryotic gene impairs the initiation of translation. Which of the following is the most likely consequence of this mutation? A. Decreased mRNA stability in the cytoplasm. B. Inability of RNA polymerase II to bind to the promoter region. C. Failure of the ribosomal small subunit to bind the mRNA properly. D. Accumulation of introns in the mature mRNA. E. Impaired polyadenylation of the mRNA. C. Failure of the ribosomal small subunit to bind the mRNA properly. Explanation. The Kozak sequence is a key sequence in the 5-UTR of eukaryotic mRNA that facilitates the binding of the ribosomal small subunit to the mRNA and ensures the correct positioning for translation initiation. A mutation in the Kozak sequence can prevent proper ribosomal binding and impair the initiation of translation. These questions cover IgG4-related disease, IgG4-RD. Question. A 50-year-old male presents with a history of swelling in multiple areas, including the submandibular glands, and elevated serum levels of IgG4. A biopsy shows dense lymphoplasmacytic infiltrates with a predominance of IgG4-positive plasma cells. The patient is diagnosed with IgG4-related disease, IgG4-RD. What is the most appropriate first-line treatment for this condition? A. Rituximab. B. Cyclophosphamide. C. Methotrexate. D. High-dose corticosteroids. E. Azathioprine. Answer. High-dose corticosteroids. Explanation. The first-line treatment for IgG4-related disease, IgG4-RD, is high-dose corticosteroids, such as prednisone. Steroids are effective in reducing inflammation and improving symptoms in most patients. IgG4-RD is an inflammatory condition that often involves organs like the pancreas, salivary glands, kidneys, and lymph nodes. Corticosteroids help control the disease by reducing the inflammatory process. Rituximab, A, is used in refractory cases or when corticosteroids are not effective. Cyclophosphamide, B, and azathioprine E are not standard first-line therapies for IgG4-RD. Methotrexate, C, is also not typically used as a first-line therapy for IgG4-RD.